If your Labrador keeps getting ear infections after swimming, after a bath, or during certain seasons, stop blaming dirt alone. Veterinary experts say the real story is usually deeper. In Labradors, the ear can become the place where moisture, trapped warmth, skin sensitivity, and hidden allergy pressure all meet together. So when you notice head shaking, ear scratching, a sour smell, or dark wax returning again, you are often not looking at one random problem. You are looking at a pattern. And that pattern matters, because many Labrador owners treat the infection they can see, while the real cause stays quietly underneath. That is exactly why the same ear trouble keeps coming back again and again, sometimes for months there. Now this is where many good Labrador owners get confused, because swimming seems like the obvious explanation. Your dog loves water, comes home happy, and 2 days later the ear starts bothering him again. So naturally you think the water caused everything. But specialists in ear disease say moisture often acts more like the trigger than the root cause. The deeper issue may be that your Labrador already has an ear environment that becomes inflamed too easily, especially when allergies are involved. That means the water did not create the whole problem, it simply made the ear a better place for yeast or bacteria to grow. And once that happens, irritation, smell and itching can build faster than owners expect. What makes this even more important for you as a Labrador owner is that repeated ear infections are often the visible sign of something happening in the body. Experts who study chronic ear disease say many dogs with recurring ear trouble are also dealing with allergy-related inflammation, even when owners first think it is only a cleaning issue. That is why wiping the ear, changing shampoo, or using random drops may give temporary relief, but still fail to stop the cycle. If the deeper skin and allergy pressure is not understood, the infection can return after the next swim or the next flare. So in this video, I want to show you what your Labrador's ears may be telling you. There is another mistake Labrador owners make, and it feels small at first, but it changes everything later. You wait for the ear to look dramatic before you take it seriously. You wait for heavy discharge, a terrible smell, loud crying, or constant scratching, because that feels like a real infection to you. But dog skin specialists say early ear disease often begins much more quietly than that. Your Labrador may only tilt his head a little, rub one ear on the sofa, pull away when you touch the side of his face, or shake his head once or twice and then stop. That quiet beginning is dangerous, because it tricks loving owners into waiting. And by the time the ear looks obvious, the inflammation has usually already been building underneath. And here is something many Labrador owners never think about until it has already gone wrong. Sometimes the ear gets worse because the owner keeps disturbing it. You want to help, so you wipe, flush, rub, or check the ear again and again, hoping cleanliness alone will solve the problem. But experienced veterinarians often warn that a sensitive ear does not always need more handling, it needs the right handling. When the skin inside is already inflamed, too much cleaning can strip protection, increase irritation, and make the ear feel raw before the next swim or bath even happens. So the lesson is not to ignore the ear. The lesson is to respect how delicate it becomes once inflammation begins. What makes ear trouble cruel for Labrador owners is that pain rarely announces itself in a dramatic way at the beginning. Your dog may wag his tail, follow you, eat normally, and still look cheerful outside. So you tell yourself he cannot be hurting that much. But people who work closely with Labrador health know discomfort often hides inside small changes. He may avoid your hand near one side of the head, sleep differently, hesitate before shaking, or seem irritable in a quiet moment. That is why some owners call the dog moody when the dog is uncomfortable. The behaviour has changed, but the meaning gets missed. Sometimes the ear is not just itchy. Sometimes it is changing the day. If your Labrador gets better, then flares again a few weeks later, that is the moment smart owners stop thinking in single events and start thinking in patterns. One infection after one swim can look accidental. But repeated trouble after ponds, baths, humid weather, grooming, pollen season, or certain routines begins to tell a story. The strongest Labrador owners are not the ones who react quickly. They are the ones who observe deeply. They remember when the smell started, what the dog did that week, whether paw licking increased, whether the skin became itchy, and whether the ears worsened in the same months before. That kind of attention changes everything. You stop chasing infections and start seeing your Labrador's triggers. So here is solution number 1, and I want you to think of this as your Labrador's afterwater routine, not a panic reaction after the ear is already inflamed. If your Labrador swims, gets bathed, or comes home with wet ears, gently dry only the outside first. Do not push deep into the canal, and do not start aggressively rubbing, because specialists say inflamed ears become easier to irritate when owners overhandle them. Then watch the next 1 to 3 days carefully. If you notice head shaking, scratching, smell, redness, or dark wax, do not guess with random drops from home. Ear specialists say successful treatment depends on knowing whether the problem is yeast, bacteria, inflammation, or something underneath. Your first job is not to flood the ear. Your first job is to observe early and react early. And here is solution number 2, which matters even more if your Labrador keeps getting these infections again and again. Stop treating every flare as a separate accident and start treating it like a repeating pattern that needs investigation. The experts who deal with chronic ear disease say many dogs with recurring ear trouble are actually carrying allergy-related inflammation, and unless that deeper cause is managed, the infection often returns no matter how many times the ear is cleaned or medicated. So your steps are simple. Keep notes on when the flare starts, what your Labrador did that week, whether paw licking or skin itching also increased, and ask your veterinarian for a full ear examination with microscope testing of the debris. The real win is not one cure. The real win is finding your Labrador's trigger.